Are the very injections meant to help your knee arthritis actually making your condition worse? New research suggests that steroid injections might be doing more harm than good. And today, I'll explain exactly why and what safer, more effective options are available. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, regenerative medicine, and metabolic health. My mission is to help you live pain-free and optimize your health using safe, cutting-edge treatments so that you can stay active, strong, and healthy for the long term. Today, I want to dive into a really important topic that impacts millions of people: steroid injections for knee osteoarthritis. If you've been to an orthopedic surgeon or a pain doctor for knee arthritis, chances are you've either had or been offered a steroid injection. It's one of the most common procedures performed in the US for joint pain. Here's the problem. While steroids can give you short-term relief, the latest research, including a larger study published in the Annals of Internal Medicine in late 2024, shows that repeat steroid injections may actually speed up joint damage, thin your cartilage, and worsen your arthritis over time. That's a huge deal because it means the very treatment that's supposed to help you may actually be setting you up for more pain and faster progression to surgery. Today, I'll break it all down for you. We'll cover why steroid injections became so common in the first place, what the newer research tells us about their risks, why osteoarthritis is really a problem of instability, not just wear and tear, why steroids make that instability worse, what healthier, more effective treatments are available right now, options that actually protect and strengthen your knees, and finally, I'll answer some of the more common questions patients ask me about arthritis care, in particular for their knees. By the end of this video, you'll understand why I do not recommend steroid injections for my patients with knee osteoarthritis and what I recommend instead. Let's start with a little history and context. Why did steroid injections become so popular to begin with? Steroids, also called corticosteroids, were first introduced in medicine in the late 1940s. At the time, they were revolutionary. They could reduce inflammation quickly and dramatically, and in conditions like rheumatoid arthritis, they were life-changing. By the 1970s and 1980s, orthopedic surgeons and rheumatologists began injecting steroids directly into joints, especially knees, shoulders, and hips, to help with arthritis pain. It caught on fast. Why is that? First, steroids worked quickly, within a few days, and patients often felt dramatic relief. Second, the procedure was relatively easy. It could be done in the office in just a few minutes. Third, compared to surgery, it looked like a low-risk, low-cost option. So for decades, steroid injections became a go-to treatment. If your knee hurt, you got a steroid shot. If it came back in a few months, you got another one. And if you failed enough shots, eventually you get referred for surgery. It became part of the standard algorithm of care. But here's the catch. Just because something is common doesn't mean it's good for you. Think about it. Smoking was once considered healthy, and a large percentage of our population used to do it. Sugar-laden processed foods are everywhere, even though, as a society, we know they're actually harmful. And in the same way, steroid injections became normal, without enough long-term evidence. And now, decades later, we're learning the truth. The relief may be temporary, but the damage can be very real. Now let's talk about the newest and most important evidence. In late 2024, a major study was published in the Annals of Internal Medicine. Researchers wanted to understand what happens when patients with knee osteoarthritis get repeat steroid injections. Here's what they found. Patients who got steroid injections did not have better long-term pain relief compared to placebo. In fact, after repeat injections, they had faster cartilage loss compared to placebo or people who did not get any steroid injections. The steroids not only fail to help in the long term, they actually made the arthritis worse. That's alarming because it means that the treatment doctors have been recommending for decades may be accelerating the very disease it's supposed to treat. Think about that for a moment. People were getting injections to avoid surgery, but the treatment may have actually been pushing them closer to needing surgery sooner. This isn't the only study either. Smaller studies over the last 10 to 15 years have shown similar patterns. Repeat steroid injections can thin cartilage, damage soft tissue, and weaken ligaments. The 2024 trial just confirmed it with stronger evidence and longer follow-up. So the science is clear. Steroids do not fix arthritis, and they may actively make it worse. That's why it's so important to rethink how we treat knee osteoarthritis. So here's where we need to shift our mindset. Most people are told that knee osteoarthritis is simply wear and tear. The cartilage wears down with age, and that's the whole story. But that's an oversimplification. Yes, cartilage damage is part of the picture, but the deeper root problem is usually instability. Let me explain. Your knee is stabilized by ligaments, tendons, and surrounding soft tissue structures. These structures are like the ropes and pulleys that hold the joint steady. When they're strong, your knee moves smoothly and evenly distributes pressure. But over time, due to injuries, repetitive strain, poor mechanics, or simply aging, those supportive tissue structures can weaken. When that happens, the joint can become unstable. Instead of moving in a clean, balanced way, the bones start to shift and wobble. That instability puts extra stress on cartilage and bones. Over time, that stress causes inflammation, pain, and progressive arthritis. So osteoarthritis isn't just about cartilage wearing out, it's about the entire joint system breaking down because it's unstable. A good analogy is a house. Imagine your house has a shaky foundation. You can paint the walls and patch the cracks, but if you don't fix the foundation, the cracks keep coming back and they get worse. Steroid injections, they're like painting over the cracks. They cover up the symptoms temporarily, but they do nothing to fix the foundation of the joint. In fact, they actually weaken the structure further. So now that we know that the real problem is instability, here's the scary part. Steroids actually make that instability worse. How is that? Steroids reduce inflammation in the short term. That's why you feel better for a few weeks. But they can also weaken collagen, the protein that makes up your ligaments, tendons, and cartilage. Repeat steroid injections actually thin out the tissue, making it softer and more fragile. So instead of strengthening the foundation of your knee, steroids actually erode it further. That's why people often find that after a few rounds of steroid injections, their knee starts to feel weaker, not stronger. And when they finally go to surgery, their joint is in worse shape than it would have been otherwise. This is why I generally do not recommend steroids for long-term osteoarthritis care. They're like borrowing from tomorrow's health to pay for today's pain relief. And eventually, the bill comes due and with interest. Okay, so if steroids are not the answer, what is? Here's how I approach it. Start with the lowest risk, highest benefit treatments, and only escalate if needed. So step one is the foundation, and that is lifestyle changes. Exercise, not just cardio, but targeted strengthening for the quadriceps, glutes, hamstrings, and core. These muscles act as stabilizers for the knee. Physical therapy can be key for many people to teach you safely the right exercises to do long term. Then there's nutrition. Focus on anti-inflammatory foods, lots of vegetables, omega-3 fats, lean protein. Avoid processed sugars and refined carbs. Then there's supplements. Omega-3, fatty acids, turmeric, glucosamine, and chondroitin can all be helpful in terms of pain relief, especially early in the disease. Step two are our regenerative injections. If you failed conservative lifestyle changes to begin with, then escalating to a regenerative treatment option makes sense. Prolotherapy. where we use dextrose, a simple sugar, to stimulate healing and strengthen ligaments. It's great for mild instability. Platelet-rich plasma, or PRP, uses your own platelets to deliver growth factors that help to repair tissue and reduce inflammation. Multiple studies show PRP is more effective than steroids or hyaluronic or gel injections for knee osteoarthritis at the 6 to 12 month mark. And then there's bone marrow concentrate derived stem cells. For advanced arthritis or significant instability, these cells can promote repair, offering stronger long-term results. And then there are other types of orthobiologics as well. For example, alpha-2 macroglobulin is a natural protein from your own blood that blocks destructive enzymes in osteoarthritis. It's especially helpful for patients with swelling or effusions. The key is that all of these orthobiologic treatments aim to strengthen and stabilize the joint rather than weaken it the way steroids do. Let me share a few patient examples. Case 1, currently an 84-year-old woman with advanced knee osteoarthritis. She had been getting steroid shots every year, but they stopped helping. We switched her to PRP combined with Prolotherapy to strengthen the ligaments and reduce chronic inflammation in her joint. Over the past 7 years, we've kept her pain-controlled and function high without requiring surgery. She's still walking and active with her family. That's a great result. Case 2, 45-year-old former athlete with early osteoarthritis of the knee. His knee was unstable from an old ACL injury. Instead of more steroid shots, we treated him with PRP and Prolotherapy. His knee stabilized, his pain improved, and he was able to get back to running. Case number 3, a 60-year-old man who was told he needed knee replacement. Instead, we utilized bone marrow concentrate-derived stem cells and combined that with platelet-rich plasma. He's been able to avoid surgery, regain his mobility, and he's back to hiking regularly. These aren't miracle stories. They're simply what happens when you treat the root cause of arthritis, which is instability, instead of just masking the symptoms. Let's discuss some common misconceptions and frequently asked questions. Number 1, but steroids worked for me. Yes, short-term relief is possible, but the price is long-term damage possibly. Number 2, what about gel injections, also known as hyaluronic acid injections? They may be helpful for a few months, but it doesn't address instability. In addition, in studies that compare hyaluronic acid or gel injections versus PRP, PRP very clearly helps more and longer term. Number 3, are regenerative treatments proven? Yes, multiple randomized trials show that PRP outperforms both steroids and gel injections for pain and function at the 6 and 12 month mark. And number 4 is, why don't all doctors use them? Reality is that steroids are cheap, they're covered by insurance, and they're quick to administer. Regenerative treatments require expertise and time, but they're the smarter long-term investment for most people. So here's the bottom line. Steroid injections give short-term relief, but accelerate long-term damage. Knee osteoarthritis is fundamentally about instability, not just wear and tear. The best treatments are the ones that build stability and resilience. Exercise, nutrition, and regenerative treatments such as Prolotherapy, PRP, and bone marrow concentrate-derived stem cells. Surgery for your knee arthritis should always be the last resort after conservative lifestyle and regenerative options have been fully tried. If you're considering a steroid injection for your knee, I encourage you to pause and think long-term. Is a few weeks of pain relief worth the risk of faster osteoarthritis progression? There are safer, healthier, and more effective ways to manage knee osteoarthritis. Ways that not only reduce pain, but also protect and strengthen your joints for years to come. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com for more expert advice on staying pain-free and healthy. This is Dr. Siddharth Dambar, and until next time, live well.